Welcome to our overview of the origins of Positive Behaviour Support, also known as PBS. Positive Behavioural Support is a values-driven, evidence-based framework designed to improve the quality of life for individuals with intellectual and developmental disabilities while reducing behaviours that challenge. When we talk about frameworks, we mean something that provides a structured approach to achieving goals and solving problems, offering clear guidelines, incorporating best practices, and allowing for flexibility. Typically, frameworks integrate theories, evidence, values, processes, and strategies, helping individuals and organizations operate effectively within their specific contexts. The PBS framework integrates person-centered planning, normalization, and behavior analysis. These movements contrast with traditional approaches, which often lacked individual focus, relied on subjective professional judgments, rigid deficit-based assessments, and excluding the person receiving support, their families, and caregivers from decision-making. Person-centered planning under PBS places individuals at the core of decision-making. It ensures their preferences and values guide support, involving them and their families in creating bespoke plans that reflect their unique aspirations. In traditional service delivery, many practices were far from person-centered. Interventions were often dictated by medical or deficit-based assessments and focused on what the individual couldn't do rather than what they could do or wanted to achieve. Professionals would impose standardized care plans, designed without the individual's input. Often, everybody with the same diagnosis would receive the same treatment and were expected to live together. Families and caregivers were frequently excluded from decision-making, leaving plans disconnected from the individual's daily reality. Non-person-centered practices were widespread. For example, individuals might have been placed into programs that served the convenience of the service provider rather than aligning with personal goals or aspirations. Routines were often rigid, with individuals having little say over their daily schedules, such as when they ate or what activities they participated in, reinforcing a sense of disempowerment. They would often be punished for failing to follow the directions of staff and lacked any privacy. In contrast, person-centered planning under PBS puts the individual at the heart of decision-making. It ensures that their unique preferences, aspirations, and values guide the support they receive. This involves critical life decisions like where they live, who supports them and when, what they eat, the skills they learn, the type of employment they pursue, and the medical treatments they receive. By involving the individual, their families, and caregivers, PBS fosters truly bespoke support plans. It's not about forcing people into predetermined boxes. It's about designing a system that recognizes and nurtures the individuality of each person. For much of history, people with intellectual and developmental disabilities were placed in institutions designed more for control than care. These facilities often resembled large, impersonal warehouses, where the priority was to manage people rather than support them to live fulfilling lives. Institutionalization led to widespread dehumanization, where individuals were treated more like objects to be processed than people with their own needs and desires. This was part of a broader societal view that saw people with intellectual and developmental disabilities as fundamentally different and, as a result, less worthy of full participation in society. In these institutional settings, service user participation and autonomy were seen as risks rather than goals. Staff assumed control over the daily lives of individuals, doing things for them rather than with them. This hotel or hospital model of care, where the focus was on feeding, cleaning, and managing behavior, stripped away personal agency. Individuals were treated more like guests in a hotel or patients in a hospital, dependent, passive, and lacking autonomy. This model also perpetuated cycles of devaluation. People with intellectual and developmental disabilities were often seen as eternal children, deviant, or even subhuman. This led to them being treated differently, which reinforced the belief that they were different and less deserving. The less favorable treatment was often framed as being in their best interests, but it further entrenched their marginalization and exclusion. Positive behavior support, by contrast, draws on the principles of normalization and social role valorization. which advocate for giving individuals the opportunity to assume valued social roles and fully participate in community life. The aim of normalization is not to force conformity to societal norms, but to ensure that people with intellectual and developmental disabilities have the same access to autonomy, dignity, and opportunity as everyone else. Normal in this context means that people with disabilities live and work in their communities, attend local schools, and experience the same normal rights and opportunities as everyone else. Social role valorization stresses the importance of people with disabilities holding socially valued roles, whether through employment, relationships, or community participation. By doing so, PBS seeks to dismantle barriers to inclusion and create environments where people can thrive as equal members of society. This approach challenges the cycles of devaluation that resulted from the old institutional models and seeks to replace them with empowerment and respect. In the past, traditional approaches to behaviors that challenge were often punitive. Interventions typically relied on physical restraint or punishment, ignoring the underlying causes of the behavior. Such methods often increased fear, intensified the behavior, and created environments hostile to growth or positive development. There was a tendency to view individuals as incapable of learning, or in some cases, to assume that behaviors were intentional and immoral choices. Positive behaviour support adopts a different stance through behaviour analysis, focusing on understanding the function or purpose of behaviours that challenge. Rather than punishing behaviour, PBS uses functional assessments to identify triggers of challenging behaviour and consequences that maintain it, in order to guide supportive interventions. These interventions focus on teaching alternative, more effective skills while reducing behaviours that challenge. Skill building is central to this process, empowering individuals to communicate their needs more clearly, increase their autonomy, and navigate their physical and social environments more confidently. Skill building is central to PBS, not only empowering individuals who receive support to communicate needs, increase their autonomy, and navigate environments confidently, but also providing those who support them with new skills to support more effectively. Changing the behavior of the people around the person receiving support is usually seen as being more important than changing the behavior of the person receiving support. This approach creates truly caring settings where people with disabilities can thrive. PBS moves beyond outdated punitive methods by emphasizing empowerment, inclusion, and proactive skill development. It creates supportive environments where people with intellectual and developmental disabilities can thrive. By embracing person-centered planning, normalization, and behavior analysis, PBS offers a path towards enriched, fulfilling lives in the settings a person wants to live in.